CIG Television and News Brief and Weather Forecast for this Friday. I'm Donna Bush. Cayman Islands government announces important measures for the Cayman Islands one day after the first coronavirus case is confirmed.
We have also decided to ban all cruise ship visits with effect from Monday, the 16th of March for 60 days. All educational institutions will close from Monday, March 16th to April 27th. With immediate effect, there will be a ban on all public gatherings over 50 persons until further notice. There are also a significant number of other important decisions which are under consideration as the threat of this virus becomes even more grave. As I've said before, some of these decisions are quite radical and drastic, and indeed some of those that we will have to make next week, maybe even more so. But we are determined to do everything we can to reduce the chance of widespread transmission of the virus through the community.
It's been shown elsewhere that you try and flatten the curve as this epidemic hits us, and that's exactly what the government's measures are aimed to do, to manage the load on our health services. I do want to say as well that we have excellent infrastructure and medical professionals in our islands, and we will come through this. We also have access to expertise in the UK, and I'm very pleased that a delegation from Public Health England, 3 people, will be arriving on island shortly to support us. This team includes a communicable disease control consultant, a consultant microbiologist, and a laboratory quality expert. And Public Health England have also been very helpful to us with some modelling about how these epidemics develop and what they might do. And they're also providing some personal protection equipment. And I do think it's very important that we will very soon, early next week, be able to test on islands. That's a really important development for us.
As of Monday, March 16th, cruise ships have been banned from visiting for 60 days. All preschools, public and private schools, including the colleges, will be closed from Monday, March the 16th as well until April 27th. There's also a ban on any event or public gatherings of over 50 people until further notice. And of course, you can watch the entire press briefing after 8 tonight here on CIG Television and on your YouTube channel, as you just heard from the Premier and His Excellency, the Governor there. Again, bans and closures are now in place here in the Cayman Islands. Meantime, the single patient in Cayman who has tested positive for COVID-19 has been receiving treatment at Health City since he was transported there on Monday after having 2 heart attacks on a cruise ship. Now, the facility closed its doors today after staff members who came in contact with the patient went into quarantine and samples taken and tested for COVID-19. The wife of the patient has also been quarantined and will be tested for the virus. Health City, in a statement, is assuring the public that all necessary precautions to contain the virus have been put in place within the facility. Today, senior government officials were on Radio Cayman's Talk Today show, where Chief Medical Officer Dr. John Lee talked about the most vulnerable.
The groups that appear to be spared are the children and the young people. So that's great news. It gives us many people who have children, they can relax. I'm not saying that children won't get sick, but it appears that it's likely that a lot of them will get sick but have very little symptoms whatsoever. And the complication rates, again, are way, way down in the children. In the other groups, the elderly, those with cardiovascular disease, diabetes, chronic respiratory disease and cancer appear to suffer more than others. So in many ways that is similar to many other illnesses in that if you have some challenges, bodily challenges already, then you don't do as well. Your body cannot respond as well. Your immune system cannot respond as well. Equally, people with sort of immune deficiencies for one reason or another.
Now, the Pines Nursing Home for those considered most vulnerable has issued a statement announcing the following. They say they've stopped all visiting by the general public to protect their residents and staff. Meantime, family members have been notified and they're asking for the general public to be patient during this time. The Pines has also banned all unnecessary travel for staff to affected countries. Meantime, there are a number of places to call if you have symptoms or to ask questions. Officials note that there's been a huge number of calls going to the hotline, so they're asking for your patience. The Health Services Authority has a dedicated email address, which is flu@hsa.ky. And of course, a 24-hour hotline access number, which is 1-800-534-8600 or 947-3077. Of course, to take calls from the public and answer any questions they're there. They may have, if you have any additional questions, there's that dedicated line for you, as well as a flu clinic and a new inpatient section will be operational shortly and will be supported by the health partners from the UK Public Health. Now, earlier today, Cayman Airways Limited confirmed that a passenger on board Flight 103 from Miami this morning presented with a cough during the flight in an abundance of caution, particularly given the heightened awareness during this time. CAL actually worked with local health authorities to put in place the necessary protocols upon arrival of that flight at the Owen Roberts International Airport on Grand Cayman. Now, Dr. Samuel Williams Rodriguez, medical officer of health, confirmed at this afternoon's press briefing that the symptoms of that patient are not those of coronavirus. Right now, many people will be unusually stressed, so taking care of you and your family's mental health is very important. Here are some tips on how to do that from community psychiatric nurse Dipna Carton.
Mental health professionals recognise and understand the feelings of anxiety, distress and concern that many people may be experiencing in relation to the coronavirus and offer the following wellbeing advice. Number 1, try to maintain perspective. While it's reasonable for people to be concerned about the outbreak of the coronavirus, try to remember that the Cayman Islands government, medical and public health professionals are working hard to contain the virus and treat and manage those affected and likely to be affected. Number 2, find a healthy balance in relation to the media cover. Being exposed to large volumes of negative information can heighten feelings of anxiety. While it's important to stay informed, you may find it useful to limit your media intake, focusing on positive, usual, everyday activities, unless otherwise advised. Number 3, access good quality information. It's important to get accurate information from credible sources such as those listed below. This will also help you maintain perspective and feel more in control. Number 4, conversations with children and young people. Families and caregivers of children and young people should discuss news of the virus with those in their care in an open and honest way. Try to relate the facts without causing alarm and in a way that is appropriate for their age and temperament. It is important to listen to any questions they may have, to let them know that they are safe and it's normal to feel concerned. If the media or the news is getting too much for them, encourage them to limit their exposure. Number 5, try to maintain a practical and calm approach. Widespread panic can complicate efforts to maintain the outbreak effectively. Do your best to stay calm and follow official advice, particularly around observing good hygiene habits. Number 6, try not to make assumptions. To contribute to a sense of community well-being, trying to remember that the coronavirus can affect anyone, regardless of their nationality or their ethnicity. Number 7, seek support. It's normal to feel overwhelmed by the news of the outbreak, particularly if you have experienced mental health issues before. Where possible, it can help to maintain normal routines unless otherwise advised by your healthcare professional. It can also help to stay in touch with friends and family, eat a balanced diet, stay physically active, try to sleep, and avoid abuse of alcohol, tobacco, and illicit drugs. Acknowledge feelings of distress and seek further professional support if required. If you're currently being treated for a mental health condition, it is crucial that you stay on your treatment. Where possible, maintain appointments and stay in contact with your healthcare professional, counsellor and support groups, unless advised by professionals taking care of yourself. As advised by the Cayman Islands Ministry of Health, reminding others of that advice you will be caring and mindful of our community too. Thank you.
Again, the important websites to get your facts on COVID-19 or the coronavirus are who.int, gov.ky, or hsa.ky. Again, that's who.int, gov.ky, or hsa.ky. Again, you can get all the facts there on any one of those websites. Again, a reminder to everyone to keep your hands washed with soap and water or with a hand sanitizer. Cover your nose and mouth when coughing or sneezing, and also keep a distance of 3 to 6 feet from others, and avoid close contact with persons who are showing symptoms of any respiratory illness. Now, while the Cayman Islands and the rest of the world is dealing with the impact of coronavirus, local fire crews have been fighting a fire at the Georgetown landfill. Earlier today, we heard from the fire chief, Paul Walker, on the situation as it stands.
Good morning, it's Friday the 13th of March. This is Chief Fire Officer Paul Walker giving you an update from the landfill fire. We've just had our command meeting and hugely impressed with the progress that's been made. Smoke density is down to a minimum, and crews are still on site working tirelessly to bring this fire to a full extinction. At the moment we're experiencing pockets of deep-seated fire where crews need excavation and turning over, and our colleagues from DEH are working on the mound of landfill to cap the site. So it's going to be more of the same today, and with the incredible progress that's been made, we've made a decision that we'll continue working through the day and we'll maintain a watching brief at night, and I would imagine that some resources would be on site throughout the weekend to minimise the risk of reignition. Safety advice to residents, businesses in the facilities remains the same. If you are suffering from any smoke, please do keep your windows, doors and vents closed, monitor your air conditioning. We've spoken with our colleagues from Royal Cayman Islands Police Service this morning, and it's hoped that the 25-mile-an-hour restriction on the East Tibbets Highway will be lifted. But again, I would ask motorists to be vigilant. If there is any smoke from the excavation and damping down, please take appropriate cautions. Once again, my thanks to all of my staff, all of the partners from DEH, the National Roads Agency, our colleagues from Royal Cayman Islands Police Service, public and local businesses for their support. I'm really hopeful that by Monday morning we'll have this fully done and our resources back off site. Thank you very much.
And turning now to the forecast from the Cayman Islands National Weather Service. Moderate east to northeast winds and a slight to moderate seas will continue across the Cayman area for the next 24 hours. It's all in association with a high pressure system over the western Atlantic Ocean. Today's high temperature reached 84 degrees, the low 74, partly cloudy skies with a 30% chance of showers is expected. Winds are from the east to northeast at 10 to 15 knots. Sea conditions are slight to moderate with wave heights of 2 to 4 feet. For more on local weather, you can go online to weather.gov.ky for the latest there. You can also download their app at CINWS. And that ends today's news brief here on CIG Television. If you missed it, please go to the Cayman Islands Government Facebook page or the CIG Television YouTube channel. I'm Donna Bush, wishing you a safe and, of course, a very wonderful weekend and inviting you back here on Monday evening to join us again. Until then, bye-bye for now.